Hi, I'm Gina, and I'm a family nurse practitioner, and I have experience working in a GI practice. So I wanted to take a little bit of time today to talk to you about reflux disease, and we're going to start with a little bit of an anatomy lesson. Many times when I see patients and they come in, they talk about the flap in their stomach. So I just wanted to clarify that and explain how your stomach works and your esophagus and what that's all about. So we have your esophagus, which dumps into your stomach. At the junction between your esophagus and your stomach, we actually have a bundle of muscle tissue. So it's not a flap, it's a bundle of muscle tissue. And that bundle is designed to sit halfway above the diaphragm and halfway below the diaphragm. So this little drawing right here is your diaphragm. And that's important because up above your diaphragm we have negative pressure, meaning we want your lungs to be able to open and expand. Obviously that's what they do. And then below the diaphragm we have positive pressure, meaning pressure is pushing in against your organs in order to give them support so that they can do all of their work. So when you eat food, food comes down your esophagus, it goes into your stomach, and then the idea is that right after the food comes down, this bottom part of that muscle bundle will close. And then that's going to allow your stomach to do all of its work and grind up your food so that it doesn't go back up into the esophagus. So what happens is, over time, we can have issues where this stops working properly. So we can have the muscle bundle might not be right where it's supposed to be. That can be a hiatal hernia. So that's when a little bit of your stomach pushes up above your diaphragm, and now that bundle of muscle tissue is not where it's supposed to be. So that's going to allow for easy reflux. So that's a structural issue. There are other things that can affect how well that muscle works, such as caffeine decreases the muscle contraction there. Peppermint actually decreases the muscle strength there. So those are two very commonly consumed muscle relaxers that can actually cause you to have reflux. So that is a little bit of an anatomy lesson about reflux disease. Now, what do we do about it? The most common thing is that a GI provider is going to put you on a proton pump inhibitor, which decreases the amount of acid that your stomach makes. There's a number of problems with long-term use of proton pump inhibitors, including increased risk of osteoporosis, increased risk of bone fracture if you fall, B12 deficiency. So those are just a couple of the very common risk factors associated with long-term use of acid reducers. Now, sometimes it's important to reduce the acid in the stomach if you've had chronic acid reflux going up into your esophagus, which causes precancerous changes or even esophageal cancer. And unfortunately, I have diagnosed and seen people with esophageal cancer, so it's very close to my heart in order to prevent that, because that is a completely preventable cancer. So it's not that we're cavalier in the functional medicine world about never using an acid reducer, but there's a time, a place, and a time span where it's appropriate to use those types of medications. Otherwise, we really need to look at structurally what's happening and what kind of lifestyle changes can you make in order to reduce those symptoms of acid reflux. A very common issue with acid reflux is actually low stomach acid. So once acid is released into the stomach, that causes the stomach to start contracting. When we have low stomach acid, then we can get stomach contractions that are not smooth, and they don't actually work to empty the food out of the stomach. So food can sit in the stomach for a long period of time and can start to ferment. And then when food sits in the stomach and ferments, it can start to cause reflux, and it can make you belch and not feel well. So a very common condition is actually slow stomach movement or slow stomach emptying, and that we actually can fix by giving people hydrochloric acid. That's not something that I ever recommend somebody do on their own. That's only something that I would do when you're working with a trained medical provider. So there are many issues that can cause reflux disease, and I highly recommend meeting with somebody who understands both the functional aspect and the conventional aspect when it comes to interpreting GI symptoms, so that you can get the most appropriate long-term plan in order to take care of your own personal needs. So I hope that helps a little bit explaining reflux disease. Take care. I'm Gina.